For our first panel, what we're going to do is we're going to take a tour around the world and hear perspectives from patients like you and their efforts to try to bring their lived experiences and their insights into advocacy and in terms of taking their experiences and impacting policy and considerations in their own countries. And so let's go ahead and take a quick run around the world.
My parents came from Philippines to Canada to give my sisters and I a better chance at life. They didn't expect that one of their kids to have a chronic illness, and thank goodness that we were born here, because the medical expenses and all the medication that I take is very expensive. And here in Canada, it's mostly covered, and like and everything's covered, except for I don't know, like rare cases of like surgeries or something, but mostly it's all paid for. Growing up as a kid, like my kidney disease didn't have a too much impact in my life. My parents made sure that I had a normal life going. As I grow older, when I transitioned from pediatric pediatric care to adult care, that was really hard on me, because it was like going to high school again, like for the first time ever, and I had to meet all these new doctors, all these new nurses, and like just be in a new environment, and that didn't go well because I don't like change, and I was a rebel back then. So I really had like a sassy attitude to everyone that met me, or just just came and take care of me. I started doing advocacy because I wanted to change Canada's like healthcare system, and also have a voice, and help those who can't help themselves. Like, I know with my journey, it was really tough to go through dialysis, go through like transplant, but I decided when I started hemodialysis that I wanted to change, like, just everything. And that's when I started to put my journey, I mean, my story on social media. And that's where I found like other like organizations around like the USA, and like also here in Canada, and um how different like the changes, us in Canada versus like US is different. Like, it's like so amazing. And to be part of like an advocacy, like the AKP no AAKP, it's just crazy. Like, I'm out here in Canada doing like bigger things that I didn't expected, and then I if I can change one person, then I've done my job. As a person with kidney disease, but also seeing like your loved ones, or like your friends and other people that are in your life, seeing you through no see you go through this is really difficult. And I know for my family, it's been hard on them, but also like it's it's a blessing to them, because like I am not most people. Like, uh most kidney patients you see, they're mostly like just in hospital doing treatment or going to clinic. With me and advocating for them, like I can just do so much more, and I believe that peer support will help new new patients with kidney disease. We are making the efforts to have research or have more innovations to have more treatment options for kidney patients, and just seeing the future and what has to come, or yeah, what has to come is making me excited um to hear to hear about these new innovations, and hopefully one day like I can be part of that process, because I have a lot of ideas that I want to get through, whether it's here in Canada or in the US or anywhere in the world. Like if they can take my idea, then that's a win-win for me. All I want to do from now to, I don't know, last years of my life here in Earth is to help kidney patients. Like I've been through so much that a 29-year-old has not been, and I just want to make that change. Like we shouldn't be suffering, especially like young patients, like in the pediatric system. Like why go through all those things as a child when you can just be living life, like being a kid, or like hanging out with friends, or doing whatever, instead of like just being at the hospital listening to all these doctors, you know like I had a transplant like 4 years ago, and it has opened my eyes from when I couldn't do things when I was on dialysis to now. It's such a big change that I just I'm just here to help others.
I'd like to thank my fellow patients from around the globe, giving their perspectives and their insights and talking about their shared experiences. One of the universal themes that you'll hear is diseases are tough to manage, but the insights that you gain and how you can apply those in the policy process to make an impact and to encourage other people to make a difference and to increase choice and options for patients is a universal theme. And that's something that the American Association of Kidney Patients, we incorporate that with our allies and we push it forward. And I really want to appreciate the folks that spoke today, because it takes courage to stand up and have your voice counted. Thank you.